In this movie, I'm going to argue that, to what extent did medicine improve during World War I? Firstly, I agree with this argument. I believe that the evolving of medicinal techniques improved drastically, which in turn allowed soldiers to live a while longer. Some examples of how medicine did improve during World War I was the innovation of facial reconstruction and artificial limbs. This allowed the soldier to become more comfortable, having to suffer all that pain for nothing, as Albert Wolseley put it. This idea enabled the use of facial reconstruction to boom into the future. Also, there were soldiers who had been scarred mentally and physically due to the violence of the war. Physical damages, as shown by this disturbing photo, were harder to cope with. In fact, many came back to hospitals with their mouth blown off, or their nose and jaw crumpled into 1,000 pieces. It would have been hard for the doctors to see their patients like this, but had it been a less violent, explosive war, and had their injuries been minor, we would have not had the medical knowledge and the equipment that we have.
But soon it became clear that many of the men returning from the front would be of little use. Soldiers suffering from shell shock, a new form of mental breakdown linked with trench warfare, were often earmarked for agricultural duties. Shell shock, however, was a far more seriously debilitating condition than it first seemed. By 1917, 30,000 former soldiers had been diagnosed with this disturbing illness. Nothing could prepare the young nurses whose job it was to care for them, like Mary Jolly.
On the other hand, mental illnesses have also become easier to diagnose. One example of this is that of shell shock, a trauma and fear which has been caused by the devastation of the war, which shocked hundreds of thousands of millions of soldiers. It was said to have only been caught through the mind of the soldier, and was easy to catch. Nowadays, we call it post-traumatic stress disorder, and the symptoms of it are things such as disorientation, delusion, limb paralysis, hysteria, and loss of speech. In this case, if it was so bad, many of them were ordered home and never to return, for they would turn into a maniac. Who had shell shock at the time, only identified by their status as cowardice, because they did not sign up for the war, were executed, unfortunately because they had the disorder. However, to combat this disease, doctors would order them to have electric shocks, or to be placed in solitary confinement. In 1917, this advancement led to places like Craig Lockhart Hospital being opened, but had visitors like the poet Siegfried Sassoon enter into their doors. The way that they were treated there was easier to treat than before, and doctors could arrange treatment around the symptoms that they had. Nowadays, doctors can use this example to try and treat this using a variety of different methods. From a negative perspective, the way in which many soldiers did not recover was due to the non-completion of facial reconstruction, which led to many of their body parts being permanently disfigured. This in turn, for many soldiers, led to them committing suicide. Also, there were the injuries themselves, which also contributed to the amount of deaths. Those that were so serious, and those that were not so serious, were often approached by rats and mice before they were approached by doctors, because of the lack of responsibility to ensure health and well-being of the soldier was maintained.